Thank you, Martha. I'm a primary care physician and medical director at Neighborhood Health. And when people or patients don't have health insurance, there are consequences. Martha just described some of the consequences to our organization, and what I want to do is describe some of the consequences faced by our patients. We have about 14 or 15,000 patients. 60 to 70% don't have health insurance. But across the state and in the communities that we're in, the numbers are much larger. We don't have the ability to serve all these patients. So many of them actually go without basic primary care. That means medications for high blood pressure, medications for diabetes, screenings for cancers like pap smears or mammograms. And we see the consequences of that. And we see that because once they've gone to the emergency room, or once they've gone to a hospital because they're in diabetic coma, because they had a stroke, we see them on the other side once they're referred to us after the fact. And those are the patients who are out there and not able to get primary care because they don't have insurance. Even the patients we see and give primary care to, those that don't have insurance, face significant barriers, significant consequences because they don't have health insurance. One thing that we grapple with a lot and we talk about a lot is the lack of specialty care. Without health insurance, a lot of our patients, a lot of my patients, a lot of the patients of a lot of the doctors and nurse practitioners where we work are not able to see specialists. What that means, and these aren't the exceptions, this is the rule, what it means is that if a patient comes in with chest pain, and it's happened this month, I'm not able to send them to a cardiologist to get a stress test to figure out why they're having chest pain. A young woman with rheumatoid arthritis working with joint pains that are getting worse, we're not able to send them to see a rheumatologist to begin the treatment that'll stop the irreversible damage that they're faced by their joints. And the examples go on. And the consequences are real. We actually had a visit to our health center from the governor about a month or 2 months ago, and he asked us a little bit more about what happens to many of these patients. And at the time, I remembered a story about one of my patients who I saw in the hospital, because we work in the hospital as well at times. And this is a patient who regularly goes to his appointments. He has epilepsy. He takes his medications. We're able to get low-cost medications for him. But still, his epilepsy from many years was not able to be controlled. He would have seizures. So he was started on a second medication and a third medication. So he's taking medications several times a day, lots of pills, 3 different ones. He comes in regularly to his appointments. He doesn't miss any appointments. He gets his blood draws. But one night when I happened to be in the emergency room, he came in with seizures yet again. He seized 4 times that day, twice in front of me. And he had to be sent up to the intensive care unit. And I was talking to the emergency room doctor that day, and I asked him, I just don't know what to do. And he said, this person, it's clear he needs to see a neurologist. He needs to see someone who can deal with this level of complexity and try to bring this under control. But the patient's been referred multiple times to go see a neurologist. Every time he calls to make the appointment, it's just too expensive. He can't go. So he takes his medicines, he comes to his appointments, but then he seizes, he's in the emergency room, and the cycle just repeats itself. I'm sure all of you know of people or have heard of stories like this. And like Martha said, like a lot of our other speakers are going to say, these are real people. They're real people in our communities, and their lives are impacted in very real ways. The consequences are real. So all I wanted to say was just to thank you for all your advocacy and all the work that you're doing. It means a lot to us as an organization. It means a lot to our community. And most importantly, it means a lot to our patients. So thank you.